Good morning, good afternoon, good evening from wherever you're calling. We're really happy that you could join us today for our webinar and tutorial on the Knowledge Management Training Package for Global Health Programs, or the KM Training Package. As people are getting logged in and trickle in, we'll wait just a couple of minutes and go over some housekeeping issues before we get started. We're really happy again for you to join the Knowledge Success Project for this tutorial. And please go ahead and introduce yourself in the chat. Let us know your name and where you're calling from, and make sure that your chat is set to go to everyone. So just to go over some housekeeping issues, I know that we are probably all familiar now with Zoom and how it works, but just in case, please make sure that you select your language. We are providing a live French interpretation for this webinar. So if you'd like to listen in on French, click the bottom of your Zoom window on the globe icon, and you can select the French channel from there and also mute the original audio. In addition, you may also select whether or not you would like to read captions during the session. You should be seeing these captions automatically, but if not, you can select them by clicking on the icon with the two C's at the bottom of your Zoom screen. If you want to hide the captions later, select that same icon and then select Hide Subtitle from the menu that appears. Just to note that these captions are generated using an automatic feature in Zoom, so they might not be 100% accurate. We also just wanted to mention that we'll be pausing before we advance each slide to give time for our interpreters to catch up. So this is what we have planned for today. We are scheduled to run for 1.5 hours. We will start with a virtual tour of the Knowledge Management Training Package so that you can understand what the goal and purpose of the KM Training Package is, and get a little bit of a preview of what types of content you can find on the training package. Then we'll go into a deep dive into a few of our new and revised training modules. So we have one training module on how to learn and share failures. We have another training module on how to incorporate behavioral sciences into the KM roadmap steps. And then another module on Knowledge Success's Learning Circles program, which is a peer-to-peer learning program to share what works and what doesn't in programs. And then we'll end our session with an open Q&A to answer questions from the audience. Please feel free to put your questions in the chat throughout the presentation. So we'll try our best to answer them as we go along in the chat, and we'll also make sure to have time to verbally respond to your questions at the end of the webinar. So my name is Ruwaida Salem. I'm the Knowledge Solutions Team Lead for the Knowledge Success Project, and I'm based at the Johns Hopkins Center for Communication Programs. In my work on the KM training package, I work really closely with my team at Knowledge Success to help them package the knowledge management approaches they use into training slides and practical exercises so that others can learn about them and apply those KM approaches in their own global health programs. I'm joined today by a number of my colleagues at Knowledge Success, and I'll have each one introduce themselves. So Sophie, would you please introduce yourself?
Yeah, thanks, Rowena. So hi, everyone. My name is Sophie Weiner. I am a Knowledge Management and Communications Program Officer too on the Knowledge Success Project at the Johns Hopkins Center for Communication Programs. I'm based in Baltimore in the US. And in my role on the KM training package, I support routine updates to the website, and I also support the development and promotion of new modules, including the Knowledge Success Learning Circles module that we'll be going over today, And as task lead of the Learning Circles activity, I work closely with Rueda and our regional knowledge management officers in Kenya, Senegal, and the Philippines to plan and implement regional cohorts.
Great, thank you, Sophie. Next up, we have Sarah. Sarah, can you introduce yourself?
Hi, everyone. My name is Sarah Harlan. I'm the partnerships team lead with the Knowledge Success Project based at Johns Hopkins Center for Communication Programs. I'm also based in the US, and I've worked in family planning and sexual and reproductive health for more than 20 years. Most of that has focused on knowledge management, and particularly within knowledge management, my interests and expertise really lies with peer-to-peer learning approaches, like peer assists, fail fests, storytelling, and I've worked on a number of these modules for the KM training package. So I'm very happy to be here today talking about one of these approaches.
Great, thanks, Sarah. Yes, Sarah is one of our super module developers. She's developed quite a bit of the content on the training package. And last but not least, we have Morgan.
Thanks, Rueda. Hi, everyone. My name is Morgan Kabir. I'm an engagement director at the Busara Center for Behavioral Economics. We have offices across East and West Africa and South Asia, but I personally am based at our headquarters in Nairobi. For the past few years, we've been working closely with Rueda and the team at Knowledge Success to apply behavioral science to improve knowledge management. As an organization, we have a vast experience working with in global health and knowledge management. So looking forward to sharing our updates with you today with the new KM modules. Back to you, Rueda.
Great, thanks so much, Morgan. Okay, so we'll go ahead and get started by giving you an overview of what the knowledge management training package is, in case you're not too familiar with the resource. So we first launched this website in 2017, so it's been about 6 years. We recently launched a refreshed website, I'd say about a year or so ago, but the goal is still the same, and the goal is to strengthen capacity and knowledge management among global health professionals. And the ultimate goal is to help global health programs use KM to learn more, share more, and achieve more and better results in their programs. And you can find the KM training package at kmtraining.org. We developed the KM training package with two audiences in mind. So our primary audience is KM trainers. So these include people who have lots of KM expertise. It could also include global health program managers who might not have a lot of expertise in KM, but who are responsible for, infusing and embedding different types of approaches to improve their global health programs. And KM could very well be one of those approaches. So the goal with these audiences is to provide them with a set of resources from the training package, basically training materials like slide decks and exercises to help them deliver a KM training workshop to other global health professionals. The secondary audience, though, includes really any global health professional who might want to learn about KM and boost their KM skills on their own. So they can review the materials in the KM training package, even if they're not delivering a KM training workshop themselves, but they can review these on their own, kind of like self-guided learning. They can also find a lot of practical tools to help them apply KM in their programs, and we'll talk a little bit more about those tools. So what can you find on the KM training package? So first things is you can find a lot of several foundational guides and tools. One of those foundational guides is called the Building Better Programs Guide. This is our step-by-step guide on how to use and apply KM in global health programs. And it goes through a 5-step process called the KM Roadmap. We've also recently published a checklist on how to assess equity and to improve equitable KM initiatives. So we really encourage folks to check those resources out. In addition to these foundational guides, what you'll find are multiple training modules on different knowledge management topics and different knowledge management approaches. And in each module, you'll find a set of slide decks that explain really the what, the why, the how, the theory behind the different KM topics. But in addition to the slide decks, you'll also find practical exercises that would help training participants really apply that theory into practice and put it into action. We also include several different types of samples and templates of different KM outputs. So you'll find things like a sample KM strategy, a sample job description for a KM officer. You'll find a KM strategy template to help you create your own KM strategies, an after action review template, a peer assist note-taking template. So there's multiple types of samples and templates that really any global health professional, I think, could find very useful. And those are very popular resources. And finally, we also include supplements. So these are links to other resources for more details on the topic for those who want to learn a little bit more beyond what's included in the slide decks and the samples and templates. So on the refreshed website, what we've tried to do is have a more modern design that really, and more importantly, we've really tried to improve the usability of the website and make it easier to access some of the key resources. We also have French translation, so the entire web interface can be translated into French through an automated French translation. In addition to that, though, what's really unique about this website is that all of the key training materials, all of the downloadable resources that were originally created for the KM training package, this includes like the slide decks, the exercises that we had just mentioned, those have been translated into French. So they're available in both English and French. So we really encourage our French audiences, our French colleagues, to make use of these resources as well. I mentioned these foundational materials, so we recently updated those last year and include those as well in French and English. And our new training modules. So last year we added modules on integrating equity in KM, on documenting program experiences. We've also included a module on peer assists and knowledge cafes. And we introduced an introductory module on integrating behavioral sciences into KM. This year, we've gone into more details on how to integrate behavioral sciences into KM by specifically outlining how to do that in each step of the KM roadmap. And we've also added 2 new modules on specific KM approaches, one on Knowledge Success's Learning Circles program and another on how to learn from failures. And that's what we'll be doing the deep dives today. We realize these are really different topics. And so you may be wondering, like, what's the common theme behind these different modules and why are they all grouped together in this webinar? And the common theme really is that these are applying different knowledge management approaches to help improve global health programs. So while you may have joined the webinar with one specific module in mind, maybe you're really interested in learning circles or in one of these other modules, we encourage you to tune in and to listen in on all of these modules because we think they could be useful, throughout your programs. Okay, so now I'm going to pass it over to Sophie to give us a tour of the website.
Thank you, Rowita. Yes, we can go to the next slide. So this is what the homepage looks like. From here, you can access those 4 foundational resources that Rowita introduced. So the KM roadmap, the KM packet guide, the Building Better Programs guide, and the equity in KM checklist. You can also access all the training modules from the homepage. We currently have 22 modules, and there is an option to filter by topic of interest. So for example, If you filter by collaboration, you will be shown modules like Community of Practice, Peer Assist, and Share Fairs. And then at the top of the page, there is a navigation menu with links to visit the About Us page and Get Started page, where you will find information on how to use the site. And if you're already familiar with the KM package, you can go straight to the Browse All Modules page. So when you click on a training module, you are brought to that module's landing page. And this one here is the After Action Review module as an example. At the top of the landing page, there are two tabs, a description tab, which is kind of the default, and a training materials tab. On the description tab, you have a brief introduction to the topic and the learning objectives of that module. And to accommodate different learning preferences, we do offer this introduction in both a video and text form. And then to access the training materials, you just click over to the training materials tab by the red arrow. So once you've clicked on the training materials tab, you can then access all the training resources, including slide decks, exercises, and other samples and templates, as you can see in this little video clip. So now that you're more familiar with how to navigate the site, let's talk about how you can get started using it right away. So if you are someone who trains others on knowledge management, you can start exploring the training modules to figure out which ones you may want to include in your next knowledge management training workshop or event. If you're facilitating a kind of a more introductory level workshop, you want to look at the modules on knowledge management essentials. For example, assessing information needs and creating a KM strategy. And then for more advanced workshops, you can look at these specialist topics like storytelling, peer assist, and knowledge cafes. You can create your own workshop agenda, but we also do provide a few sample agendas. We have one for a one-day workshop on KM basics. We have an agenda on a 3.5-day workshop that does a deep dive into KM. And then we also have a 5-day workshop agenda that does that deep dive and then also digs a little bit more into those specialized KM areas. So once you've created your agenda, you'll start adapting the various training materials. For example, in the PowerPoint decks and Word documents, you'll want to add your own branding and logos. You can replace any photos or images with your own. You can also add context relevant content like your own challenges and activities. And you can also replace examples that we have provided kind of as a placeholder with your own examples. So although the KM training package was primarily developed with the KM trainer in mind, even if you're not a KM trainer, but you are interested in learning more about KM and applying KM tools in your work, you can still certainly benefit from the site. So you can explore the different modules that we have available and find one that is interesting to you. We recommend you start with the slide decks to understand what that KM topic or tool is about. Detailed presenter notes are included in the slide notes section that you can review on your own. You can also do the exercises on your own to put theory into action. And we do hear from people that those samples and templates are very helpful to their work. So that is the end of the tour portion of the webinar. So now I'll pass it back to Rowena.
Great. Thank you so much, Sophie, for walking us through that. That was really helpful. And we hope that was helpful for all of you tuning in. I'll turn it over to Sarah now. She is going to provide our introduction into the Learning from Failure module.
Great. Thank you so much, Rueda. So yes, I'll be providing an overview of our new Learning from Failure module. I'll present some of the tools and tips that we included, but note that this is not the complete module. So we do encourage you to visit the link on the screen for additional materials, tools, and the full slide deck. Next slide, please. So we're really excited about this new module. We've been working a lot recently with the family planning community on sharing failures. We've gotten some really great responses from the community, and we know this is filling a great need to share both what works and what doesn't work in our work. So in this Learning from Failure module, our objectives are for users to understand the importance of sharing failures for global health and development programs, to describe how to plan and host different types of sessions and to share failures, and to share tips to successfully encourage sharing of failures. Next slide. So first, it's important to have a common understanding of what we mean by failure. So this module discusses some examples of failure definitions. When defining failures, some have distinguished between incorrectly executed tasks or routines. For example, if a healthcare provider gives the incorrect medicine to a patient, that would be a failure. So that and undesired performance outcomes. So for example, a patient who dies after surgery rather than leaving the hospital healthier. And others classify failures on a spectrum from preventable in predictable operations to intelligent failures. And intelligent failures might occur when experimentation is necessary. So with all of this in mind, we use a broad definition of failures, and we think this encompasses any of these situations. So this is our definition. Failure is when the results don't meet your expectations and you are unhappy with the way things turned out. Failure is a teachable moment. So with these definitions, it shows that the same experience could be construed differently depending on who you are and what your expectations were to begin with. So two people working on the same activity may have different thoughts about whether something was a failure or not. So why is it important to share failures? That's on the next slide. Or sorry, why is it hard to share failures? Let's see, next slide. Great. So even though many of us do recognize that failures are teachable moments and are very important to share, it can be really hard. And it's hard for all of us in different ways. So here are some of the reasons why it could be hard to share failures. There are three main categories of barriers when we're sharing failures. First of all, there's emotional barriers. Experiencing failure can lead to negative emotions like sadness or guilt. These experiences are also often embarrassing, difficult, or painful. So many of us would rather leave them in the past rather than retelling the story. There's also cognitive barriers. So for example, you may not see the purpose of sharing failures, or you may not believe that failures contain any valuable information. Even when one does recognize failures, learning from them may be more complicated than learning from success. And there's also organizational barriers. So for example, organizations may not provide enough opportunities or time for employees to reflect on failure. If it's not part of regular meetings, for example, we may just forget about it and move on. If this is not part of the culture, employees may not feel encouraged to share their failures. There also may be different power dynamics at play when sharing our failures. So it might be easier to share if you're maybe a more seasoned professional rather than earlier in your career. And you might be worried about admitting to a mistake or failure and thinking it could jeopardize your job or funding. So these are just a few of the challenges that we face when we're sharing our failures. I'm sure those of you listening have many more. But on the next slide, we talk about why it's important to share our failures. So failure is a normal part of our work. Mistakes and failures are requirements for learning and success. And learning from our personal failures can help us avoid repeating these mistakes in the future. Sharing our failure experiences with others can help them avoid making the same missteps, and talking about what didn't go well can actually help us be more constructive and effective and ultimately lead to strengthening our programs. We talked earlier about how hard it is to share failures and the reasons we might give for not sharing them. And so normalizing sharing our failures as well as our successes will help us improve and strengthen our health and development programs. As we start to share failures and get more practice doing this, it will help us become more comfortable sharing failures in our everyday professional lives and with our colleagues. And finally, sharing failures with each other can also lead to innovation as we learn from our peers as to what they've tried, what hasn't worked for them. So these stories can help make the unpredictable predictable. Next slide. So here are some different ways to encourage the sharing of failures. These are some techniques that the Knowledge Success Project has experience with. For example, we've convened a panel presentation at a conference where each presenter shared a failure that they've experienced in their programs, and the moderator facilitated a discussion among the panelists to share lessons learned from those failures. So that's one way. Our project has also conducted or participated in a number of FailFest events. These can either be within our own organizational settings where staff members volunteer to share their failures with others in a fun, kind of humorous, relaxed environment. And typically these kinds of FailFests are held after the normal work hours in an external location that's more private and it has just a more fun atmosphere. The project has also had really good success with hosting interactive small group events where everyone is prepared to share a failure in a small group. Participants in these events typically come from a range of projects and organizations, but they can also be held within an organization as well. And Knowledge Success has also regularly conducted after action reviews with our teams at the conclusion of major events or activities to reflect on what went well, what didn't go well. You can also use mid-mortem reviews, which are not at the end, but they're similar to after action reviews, but they're meant to be conducted more regularly throughout implementation, not just at the end. So on the next slide, we talk about some key considerations. Key considerations for choosing a format to share failures. So it's important to consider audience, group size, and goals. The module talks a lot more about these in detail, but for the sake of this presentation, we're not going to go into these individually. On the next slide, we talk about tips for planning and hosting successful failure sharing sessions. So again, in the module, we go through each of these tips one by one, but today I'll just expand on one of them, number 3, which is ask questions. Next slide. So this is one part of our approach that has been particularly interesting and helpful during our failure sessions. These what we call curious questions. This model was adapted from the NGO Fail Forward. So we acknowledge Fail Forward with the term curious questions and for this concept. So the questions are really helpful because people might hesitate to share their failures in a forum because they don't want to be put in the spotlight and have to answer questions that may sound as if they're being blamed. So these curious questions can help ensure that participants focus on the learning and not the blaming during discussions around failures. Curious questions are meant to help the teller better understand their failure, learn from it, and incorporate that learning into their future work. Curious questions are not meant to help problem solve the failure or discuss what the teller should have done differently. It's really more for learning and for bringing out those lessons learned. Next slide. So here are some examples of curious questions. Note that these questions help the storyteller learn more about their own failure, not rehash the experience. So things like what makes this failure meaningful? What did you learn? What makes this story important to share? How has your understanding of the situation changed since this happened? And how are you wiser from the experience? So these questions are also acknowledging that the act of telling a story, and sharing your failure with others can actually help you process it more and learn more from that experience yourself, as well as sharing it with others. And finally, related to this FailFest module, I wanted to just share a little bit around some of the knowledge success work that we've done in this area. So Knowledge Success has conducted some sessions around failure, and we found that these learning sessions were generally well received by participants. They appreciated the safety that the events provided, along with the camaraderie, knowing that other individuals and programs have experienced the same challenges or similar challenges. And in a post-session survey from one of these events, 86% of respondents agreed or strongly agreed that the session motivated them to be more open to sharing their failure with colleagues. And one participant noted that it was like a support group. So these participants felt that sharing in small groups was really useful. They also liked the curious questions approach. They said that these sessions made them feel reflective. And we also learned that a significant portion said they felt embarrassed. So we still have some work to do before failures can be shared openly and before this culture has really been shifted. But overall, participants said that they really learned a lot from other failures and indicated appreciation for these sessions. So as I mentioned, the other tips for sharing failures are included in the module. So we encourage you to look at that in more detail, along with some of the exercises that we put in as well. But we're very excited about this new module. And with that, I will thank you so much for your attention, and I'll hand it over to Rueda.
Great. Thank you so much, Sarah. And I really like that tip about when you share your own failure, you're also learning more from that experience. There's something about like just talking through it that helps deepen your own learning. So as hard as it is, we all have a hard time, being open and transparent sometimes about the failures we've experienced. But I think we just got to keep remembering that we all experience failures, and this is a learning moment for all of us, including ourselves. With that, I'm going to turn it over next to Morgan. Morgan's going to take us through how we've incorporated behavioral sciences into the KM roadmap.
Thank you, Rueda. And thank you, Sarah, for the really interesting overview of failures and sharing failures. Today, I'm going to be speaking about the new training modules on incorporating behavioral science into knowledge management. So really what these are focused on are how to create knowledge management tools, techniques, and strategies, and how to use different approaches from behavioral science to improve their efficacy. So just a quick overview of behavioral science and what we do at Busara. So behavioral scientists study what drives human behavior, and that's really the core of what we do at Busara and what we've been doing in close partnership with the knowledge success team over the past few years. Whenever we think about knowledge management, we think about KM as a series of behaviors. So on this slide, we've broken knowledge management down into 3 different behaviors: seeking information, using information, and sharing information. And so whenever we're looking at knowledge management through a behavioral science lens, we think about ways to encourage these 3 behaviors to make knowledge management more effective. Basically, what we're looking at whenever we take a behavioral science approach to knowledge management is to different ways to enable or overcome different enablers and barriers to seeking information, using information, and sharing information. So this is how we've approached incorporating behavioral science into the new KM modules, which I'll talk about in more detail throughout this presentation. So we have developed 6 modules to provide end users with tools and strategies for developing different KM tools, techniques, and strategies. Following the KM roadmap that we have laid out here, during today's presentation, I will be taking you through these different modules at a very high level, really emphasizing the different changes that we've made and the behavioral science aspects that we've incorporated. But really what these modules aim to do is to take the participants through a process of developing KM tools, techniques, and strategies, from understanding the user's needs and understanding what they want and need in terms of KM tools and strategies, developing different KM tools and strategies that meet their needs, and then finally monitoring and evaluating these tools and strategies to make sure that they're doing what they're supposed to be doing and having an impact. And throughout each of these different steps, each of these different modules, we are using behavioral science and focusing on different ways to encourage users to search, use, and share different information. So I'll be going through each of the modules just at a very high level. This isn't meant to be a comprehensive overview of everything that's in the modules. There's a lot of really rich information in there. Today is just meant to be a bit of a taster to give you all an understanding of what you can expect to find in these different modules. And then, of course, to really emphasize the behavioral science aspects of how we're approaching knowledge management and getting people to engage in knowledge management behaviors and follow through on these different behaviors. So the first module that we have developed is just an introduction to KM and behavioral science. This module lays the groundwork for the subsequent modules and really defines and explains a lot of key terms and definitions from behavioral science and provides examples of how they can be applied to KM. So just to give you a quick overview of what's in these modules, what's in the first module, the Introduction to KM and Behavioral Science module. We start with an overview of behavioral science, simply defining what it is, similar to what I've just done in this presentation, but with a little more detail. And we provide some more detail on how behavioral scientists approach decision-making, describing key terms like the intention-action gap and how that relates to knowledge management. We also define key terms that are important for behavioral scientists to understand and help the participants of these, the users of these training modules think, in terms of different behavioral science concepts. Some of the concepts that I have listed here on this slide, just to provide you an example of what's in the module. We have System 1 and System 2 thinking. We define cognitive biases, and we also define heuristics, all of which are important to think about as you're developing KM tools, techniques, and strategies. We also provide some examples of common heuristics and biases and how they impact decision-making and KM behavior. Just to give you a quick example of the types of information that you can find in this module. One example of a common bias that really affects how people search and use information is the confirmation bias, which basically says that as humans, we have a tendency to seek out and use information that confirms our pre-existing beliefs. So that just gives you an idea of the type of concepts you can expect to find in here and how they relate to KM, because that one is obviously pretty easy to relate to KM, given that it directly impacts how people search for and use information. And in this module, finally, one of the things that we introduce that is important for the subsequent training modules is two really important frameworks that underlie a lot of behavioral science work. One framework that we introduce is the motivation, ability, opportunity framework. This framework is commonly used in behavioral science to think about why and how people follow through on certain behaviors. So for example, searching information, whenever we're thinking about why and how people search for information, we need to think about if they have the motivation to search for information, if they have the ability to search for information, and if they have the opportunity to search for information. And I'll describe in a little more detail how we incorporated this into the KM training and how it can be applied to developing KM solutions. Another important framework that we introduced in this module is the EAST framework. The EAST framework was developed by the Behavioral Insights team, and it basically stands for easy, attractive, social, and timely. And what this framework does is it can be used when developing new solutions that will help make them more user-centered, and help increase the likelihood that people use them and their overall impact on whatever it is that we're trying to impact. So in here, it's of course knowledge management behaviors and improved knowledge management practices. And again, I'll speak in a little more detail later on in the presentation about how this can be applied to KM. So moving on to the first module. So after we've kind of set the scene and defined some of these key behavioral science terms in the first module, that's just the introductory module. Step one is assessing user needs. So what this module really focuses on is trying to understand the needs of end users and providing our end users, the people who are using these modules, with the tools and techniques to better understand their end users. So this provides us, what this module provides is an overview for the steps for conducting a needs assessment to try to dig deep into the needs of your end users. We also provide some different tools and techniques to try to understand what these needs are. So we describe research methods like focus group discussions, key informant interviews that can help you gather information on the needs of your end users. We also provide an overview of questions to ask for developing monitoring strategies to intentionally incorporate equity into KM tools, techniques, and strategies. So in addition to incorporating behavioral science into these modules, you'll also see that we have a lot of equity considerations throughout the modules too. So you're intentionally incorporating both behavioral science and equity into the design and implementation of your KM tools, techniques, and strategies. One of the most important things from my behavioral science perspective that we've incorporated into this module is the tools to help the users develop user journey maps and personas. What this helps do is to visualize the different enablers and barriers that users experience in accessing and using different KM tools and strategies, and the different enablers and barriers that they experience in seeking, using, and sharing information. So these tools are really valuable in helping to really visualize and helping to make concrete these different challenges that users may be experiencing to accessing tools and techniques, and how we can be designing strategies around the different challenges to help overcome them, which I'll describe a little more in the next module. And finally, we have a list of behavioral biases that can be applied and must be considered whenever we're developing new KM tools and techniques. Based on research that we've conducted in the past, Busara in partnership with Knowledge Success, we've conducted a lot of research to understand the biases and heuristics that users experience in seeking, using, and sharing information. We incorporate some of those findings into this module for everybody to benefit from whenever they're designing their tools and strategies. And these are particularly important when understanding the needs of end users, because this sheds some light into how end users might think whenever they're following through on different KM behaviors and what could be driving their behavior. So for step two, this step focuses more on taking the what we've already understood about the wants and needs of our end users, and using that information that we've gathered in step one to develop a KM strategy in step 2. So this focuses a little less on behavioral science and more on the practical next steps of developing KM tools, techniques, and strategies. Thinking about how to develop new strategies that are really grounded in solid theory, and also grounded in the wants and needs of end users. So in this module, we provide an overview of the steps involved in developing and implementing new KM strategies. And in what's actually very important about this step here, which I'll talk about in more detail later, are instructions on how to build an M&E plan into the design of new KM strategies. It's important to consider these things while you're designing your KM strategy to give you data that can be used to improve your KM tools and techniques as you're going through implementation. So after completing step 2 and developing and designing a new KM strategy, step 3 takes you through how you can create and iterate upon this strategy while you're doing implementation. So really, what step 2 focuses on doing is how to design a new strategy kind of on paper, and what step 3 does is how to then go take this idea for a new KM strategy and implement it and iterate upon it so that it's very user-friendly, meets the needs of end users, really incorporating steps 1 and steps 2 into the design and implementation of the new strategy. So just at a high level, what we provide in this module, we list different KM tools and techniques that can be used, and describe, when the best when opportunities present themselves to use these different KM tools and techniques. One of the things that we've recently incorporated into this module here, which is very important, is the EAST framework that I mentioned earlier. We've developed an EAST framework cheat sheet that'll help end users consider the EAST framework as they're developing and implementing their new KM strategy. And what this cheat sheet does is it provides different tools and considerations that should be made to make a new KM solution more user-friendly. So what we do is within this cheat sheet, we took the EAST framework and we break it down into different biases that could be preventing a solution from being easy, for example. So I'll just use easy now as an example, but there's also examples for attractive, social, and timely, which is what EAST stands for. So we look at the different biases that could be preventing a solution from being deemed easy, because at the end of the day, you want your KM solution to be as easy as possible, or else users won't take it up and use it. So really, when we look at easy, we want to be looking at how to remove hassle factors. So looking at ways to get rid of some minor inconveniences that might have disproportionately large impacts on behavior. And thinking of, as this applies to knowledge management specifically, what can we do to get rid of these hassle factors? So that's one of the things that we have listed on this screen. We provide different examples for, how this can be applied to knowledge management, and how we can use the EAST framework to think about making the new knowledge management solutions as easy for users to use as possible. And it's also important to make it, of course, attractive, social, and timely, which you'll find more detail on that in the EAST framework cheat sheet that we developed. We've also, in this module, have guidelines for iteratively improving KM tools and techniques, ensuring that, with each iteration, the KM strategy becomes more user-friendly to increase uptake and use. And we also have guidelines for conducting usability testing, again, all of which is aimed at making sure that the KM solution is user-friendly. So in step 4, now that the KM solutions have been implemented and iterated upon, step 4 provides information on how we can monitor the solutions. And here's where the MAO framework, when I say MAO, I'm referring to the framework that I mentioned earlier, the motivation, ability, and opportunity framework. What we've done with this module is we've incorporated indicators that align with MAO to help make the monitoring frameworks that we explain how to develop in these modules, to explain how to make monitoring frameworks more grounded in behavioral science. So really what this module does at a very high level is it explains and provides steps on how to create monitoring frameworks. And the new behavioral science information that we've incorporated into this module focuses on providing examples for how to use the MAO framework and thinking about how users are motivated if they have the opportunity and ability to use these different KM solutions that have been implemented. And with this information, you can, of course, monitor if users continue to have the motivation to use the new KM solution. And if not, if you find that, for whatever reason, users don't have this motivation, you can, of course, iterate and improve your product to increase this motivation, all with the end goal of improving knowledge management behaviors. Again, that's the searching for information, using information, and sharing information. So what I have here on the screen is an example of the MAO indicators that we've developed, which can be incorporated into monitoring frameworks to monitor the motivation, ability, and opportunity of end users. For this new module, we have the different examples of different indicators that you can include in your frameworks. And we also provide examples of questions you can ask that will gather information on these indicators so that you can measure these. You can measure essentially the motivation, ability, and opportunity of your end users. And finally, in the last 2 minutes here, our final step is on evaluating and evolving the KM strategies, techniques, and tools that have been developed throughout this project. So, after the KM strategies have been implemented and we've monitored them, we now want to evaluate their effectiveness, evaluate their impact on whatever it is that we're trying to measure their impact on. So we want to be measuring their impact on, in this case, it's KM behaviors. So again, seeking, using, and sharing information. So what we do with this module is we provide an overview of what outcomes to measure and how to select different outcomes. We also provide information on the different evaluation methods to use and when and how to use the different methods. We describe different data collection methods and best practices for analyzing and visualizing data. And finally, we provide guidelines for disseminating the results of the impact evaluation. Again, we've incorporated some behavioral science aspects into how we disseminate information because this is, of course, another KM behavior. And for this particular activity, for this particular behavior, we provide guidelines on how to incorporate EAST into disseminating information. So, for example, how you can disseminate information to make it easy for people to use the information, to make it easy for users to share the information with other people. So this is all very much grounded in the EAST framework and how, again, you can use different frameworks from behavioral science, in this case, the EAST framework, to encourage people to share and use the information that you produce. So with that, thank you so much for taking the time. I hope you found this useful, and I hope you find our modules useful as you design and develop new KM tools, techniques, and solutions. And with that, I'll pass it back over to Ruwaida.
Great. Thank you so much, Morgan. I know that was a lot of information to share with our audiences here. I think the ultimate goal of incorporating these new updates to the modules is to really allow a greater number of people to benefit from the strategies and techniques of behavioral sciences. I think we'd all really appreciate having a behavioral scientist sitting right next to us and guiding us throughout this process, but we know that's not always possible. So I think trying to synthesize and share some of the key strategies that behavioral scientists use could really benefit all of us using knowledge management. And, that motivation, ability, opportunity framework in terms of helping to assess needs and identify, how people currently approach knowledge management and how we could improve that experience. And then using the EAST framework on the other end, can really help us design knowledge management solutions that address those needs. So we hope that you'll be able to dig into these modules one by one and find some really practical tools to help you apply those guidance into your work. Please feel free to use the chat to enter your questions. We will definitely be setting aside a good chunk of time at the end of this webinar to answer those questions and make sure we have enough time to address those questions. Next, I would like to turn it over to Sophie. We have one more training module that we'd like to provide an overview on, and this time it's our Knowledge Success Learning Circles program. So over to you, Sophie.
Thank you, Rowena. Yes, so I will now be presenting on Knowledge Success's Learning Circles module, which we just published in August. So we're really excited to have this out for the public. Next slide. The objectives of this module are for global health and development professionals to, first of all, understand what the Knowledge Success Learning Circles is and what the goals of implementing a cohort are. Also to be able to identify the key components of the Learning Circles program. And lastly, to know the steps needed to plan and prepare their own cohorts. So what is Learning Circles? Well, the Knowledge Success Learning Circles is a participatory peer-to-peer learning program for global health professionals to discuss and share what works and what doesn't work in pressing program implementation topics. We developed Learning Circles because we learned through a series of co-creation workshops that we hosted with members of the family planning and reproductive health workforce that there was a need around improving knowledge sharing and exchange, especially in a digital space during the COVID-19 pandemic. Because of the COVID lockdowns resulting in an increase in remote work amongst our audiences, the Learning Circles program was originally designed for a virtual setting. However, the module does include some recommendations for implementing an in-person cohort, which we will review a little later. So through these co-creation workshops, we discovered that family planning and reproductive health professionals were really looking for detailed implicit knowledge and experience about how to implement successful programs. So the kind of information that you're probably not going to find in more formal reports and articles. So to address this gap, the project created an online series that we call Learning Circles to facilitate transparent dialogue, learning, and networking amongst professionals who are based in the same region. And the regions that we focus on are East Africa, West Africa, and Asia. While the activity was initially designed for family planning and reproductive health professionals, the program can really be easily applied to any global health topic. So for example, in March and April of this year, our team successfully adapted and implemented the model for an in-person workshop series with global health professionals who are working on COVID-19 vaccination. So by creating an open space where participants feel comfortable sharing with peers really that detailed, practical solutions to program challenges that are relevant to their context, Learning Circles aims to improve global health professionals' ability to replicate and adapt best practices while also avoiding past mistakes. In addition, the Learning Circles model is structured around a range of knowledge management tools and techniques, which participants can also adapt and use with their colleagues and networks. So here is an overview of the Learning Circles program and the knowledge management techniques that we use to kind of drive conversation in each session. So in a virtual setting, cohorts meet over Zoom for a 2-hour session once a week for 4 consecutive weeks. And then in between those 4 live sessions, facilitators kind of keep the conversation going by prompting participants to continue to reflect and exchange with one another over WhatsApp. In session 1, participants are introduced to each other and to the technical global health topic that the cohort is addressing. In session 2, participants explore what's currently working well with the cohort topic using the approaches of appreciative inquiry and one for all. In session 3, participants dive into what their teams and projects could be doing better to improve global health outcomes. And then finally, in session 4, participants take stock of everything that they've discussed throughout the series in terms of what's working well and what could be improved. They also reflect on lessons learned using a cover story activity. And then we conclude the series by having participants develop individual action plans for moving forward through a commitment statement device. And then after the cohort closes, we really encourage participants to continue to connect and share their experiences with one another. And in the following slides, we'll take a closer look at each of these 4 sessions. So starting with session 1, getting to know each other, the purpose of this introductory session is really to give an overview of the series, explain how things will work, and give space for participants and facilitators to get to know each other, as well as familiarize themselves with the various virtual tools that they'll be using throughout the series over Zoom, like Google Jamboard, Google Slides, Google Docs, and the Zoom Annotate feature. We recognize that these tools might be new to some people, so it's really helpful to have this time in the first session to practice becoming comfortable using them. So in this first session, facilitators conduct icebreaker activities, present the technical topic of the cohort, and it's also a time for facilitators to manage participants' expectations for the series. This initial get to know you time is really necessary for encouraging participants to share openly about program experiences, especially about their challenges, which from Sarah's presentation we saw can be really tough to talk about. And it's particularly important in a virtual setting where that relationship building can be more challenging. So when presenting the technical topic in the first session, we recommend using an evidence-based framework, which participants can use kind of as a guidepost in their discussions throughout the series. For example, in a cohort led by our Knowledge Success Asia team, which focused on the topic engaging men and boys in family planning and sexual and reproductive health, the cohort anchored their discussions around breakthrough actions model for male involvement in sexual and reproductive health and rights. And since we want participants to view themselves as the experts on the topic, in addition to proposing frameworks, facilitators should also invite participants to share any relevant frameworks or approaches that they are familiar with and think would be helpful to reference during the series. So as I mentioned, we also take time to set expectations during this first session. And this is just an example of what a completed expectations board might look like. In a virtual setting, we use Google Jamboard. So participants first share in small groups with each other what they hope to get out of the Learning Circle series using these virtual colored sticky notes. And then they can kind of move around and organize their ideas by theme. And then they share out those main themes or key points in plenary. And then this time also allows facilitators to respond in real time to any expectations that are kind of out of scope for the series. So moving on to the second session, this is when participants talk about those factors for implementing successful global health programs related to the cohort topic and ways to really amplify those successful strategies on a larger scale. And to facilitate this discussion, we use two CAM techniques. The first is appreciative inquiry, and the second is one for all, which is actually an adaptation of the more popular 1-2 for all activity, which some of you may be familiar with. We just removed that second step to make it a little easier to facilitate in a virtual setting. So starting with appreciative inquiry, what we do is we reframe questions from what's wrong to taking a more positive outlook of thinking about what's right. And then we ask, how can we do more of what's working? And this technique helps people focus on those really exceptional moments or those experiences that stand out, and if replicated, could improve other programs or the field in general. And to really get at that replication piece, facilitators have to kind of probe participants to focus not only on why was an activity or project a success, but how was it a success? So what were the conditions that made the experience possible? What were the tools or resources or processes that the team used, for example? And to guide appreciative inquiry, we use the knowledge management technique One for All, as I mentioned. So for those that are not familiar, the steps to implementing One for All are: first, participants are given some time to silently by themselves reflect on their positive experiences in their programs and think about those conditions that made it possible. The next step is for participants to come together in groups of 4 where they share and develop upon their ideas and look for the similarities and differences between them. And then lastly, step 3, participants regroup all together in plenary and report out any of those aha moments that really stood out in their small group discussion. So this is an example of what a group's Google Jamboard for the One for All activity may look like. Remember, this is the second step where participants have already had some time to self-reflect on their exceptional experiences, and then they move into their groups of 4 to discuss. So in their groups, they share details about their exceptional experiences and then group similar ideas by theme. So this sample board actually shows an example from the Knowledge Success Project, where our successful experience was how we created learning circles along with 2 other knowledge innovations called the Pitch and FP Insight through those co-creation workshops that I mentioned earlier in my presentation. So in the first column on the yellow sticky notes, participants give kind of a basic summary of their exceptional project or program with key details like who was involved, where and when the activities took place. Moving to the second column on the green sticky notes, they explain reasons why the project was a success. So looking at our project example, one reason that the co-creation activity worked so well was because we were really designing solutions with our audience and not just for them. In the third column on the orange sticky notes, participants continue to build on their success story to get to that how piece. How did they achieve success? What were the tools, processes, or resources that they used? So again, with our example, we said we co-created with our audiences, but how exactly did we do that? So we used a 5-step design thinking process. We also decided to divide our workshops by region. So these kinds of details are important when we think about how other participants in the group might take what they heard and replicate or adapt successful experiences to their own context. And then lastly, in the final column on the blue sticky notes, participants try to come up with some cross-cutting themes that they're seeing across the different successful experiences. So moving on to the third session, this is when we discuss solutions to participants' individual program challenges. And for this, we use a knowledge management technique called Troika consulting. The purpose of the session is for participants to get practical and imaginative help from colleagues immediately using quick round-robin consultations. So it's a form of peer-to-peer coaching. And how does this work? So the word troika actually means 3. So in groups of 3, each participant has a turn to ask a consulting question. And in our case, they are sharing an individual challenge as a person working on this global health topic and asking for advice. And then the other participants in their group come up with the ideas and suggestions to address the challenge. Then you just kind of repeat this process until each participant has had a chance to share their challenge and receive help from the group. So in a virtual setting, we use Google Slides for Troika consulting. The slide deck includes an individual slide for each participant to take notes. On the left-hand side is where the participant will describe their individual challenge, which they will present to their fellow group members in their small breakout group. On the right-hand side of the slide, there is space for participants to take notes on the advice that they receive from their fellow group members on how to address their challenge. And what's nice about using a shared Google slide deck like this is that participants, they'll have access to this even after the series. They can kind of go through the whole slide deck and look at other participants' challenges, see if there's anything similar that they're also struggling with, and see the solutions that were proposed. So moving on to our final session, this is when we take stock of everything that had been discussed in the previous 3 sessions around what is and isn't working based on the participants' own knowledge and experiences. Next, we develop lessons learned for future success using an activity called Cover Story. This activity is designed to encourage participants to imagine what success looks like a few years down the line and think about how they would do things differently based on the knowledge that they have learned throughout the course of the series to achieve that successful scenario. And lastly, they'll take all of that information into account in order to create an action plan for immediate practical next steps that will address their individual challenge that they worked on during their Troika consulting session in session 3. So to accomplish this, they each develop their own commitment statement, which is an evidence-based method rooted in behavioral science that has been shown to increase your chances of not only remembering what your commitment was, but it also increases your chances of actually acting upon it. So we use Google Jamboard again for the cover story activity. This is an example from the COVID-19 vaccination workshop that I mentioned earlier. In this activity, the kind of fake ideal scenario that we had participants imagine was to pretend that a public health emergency of international concern occurs a few years into the future, where several effective vaccines are rapidly developed and rolled out, saving billions of people around the world. Not only that, but the vaccines are distributed in an equitable manner, reaching both high income and low and middle income countries. So to develop this cover story, we have participants focus on kind of 3 elements in their small groups together. So on the first slide, participants brainstorm those key factors that led to this best case scenario. On the second slide, they imagine illustrative quotes to include in the imaginary cover story. What are people saying about this event? And then lastly, on the third slide, participants reflect on who the key stakeholders might be, who would contribute to this success. So health workers, ministries of health, partners, donors, and also why they were essential to this success. And so to close out the series, participants create their commitment statements in a shared Google Doc. A good commitment statement describes a practical and immediate action to address the participant's individual challenge. The action should also be within the participant's control in terms of things like time, resources, and power. We don't want them coming up with like really lofty goals, which could help the global health community, but if they don't have the individual power or resources or time to do it, that's not going to be helpful. So we want really actionable items that they can take after the workshop. Commitment statements should also strive to amplify what's already working well and avoid what hasn't been working well in this area. And lastly, including a deadline date will encourage participants to commit to their action step in a timely manner. We usually give participants between 2 to 4 weeks. And then facilitators can also follow up with participants a few weeks after the series ends to get progress updates on their commitments. And here are just a few examples of commitment statements developed by participants from our past cohorts. I can just read one. For example, I commit to identify 5 key organizations in my province working for youth. So it's just a first easy next step for them to take and kind of get the ball rolling. So that was the crux of the 4 sessions in the program. The module also gives guidance on the key steps for planning and implementing a learning circles cohort, which we'll now take a look at. So step 1 is to assemble your team and assign clear roles. What I'll say about this is it's really important to bring in facilitators that are skilled at asking those probing questions we talked about around how and why participants' programs are successful. And the KM training package module does include some guidance on what makes a good facilitator. It also helps to have someone in charge of logistics who coordinates with participants, sets up the Google Drive, manages the Zoom and breakout rooms. So if you have the luxury to bring on someone like that, that can be really helpful. Step 2 is to create a timeline of key tasks. It helps to have a digital tracker, either through Google Excel or Airtable, with clear deadlines. The module also has a template tracker that you can adapt. This really helps cohort team members complete important tasks and provide status updates in real time. Step 3 is to develop and share an application or an invitation process. So a tip here is when reviewing your applicants, some things you want to consider are things like the number of cohort members you want to have. Our cohorts are typically 30 participants, but also think about how much experience on the topic the applicant has. So remember, they are the experts in this field. So we really want to be bringing together people who have the expertise to have these conversations. And also, if there are any power imbalances between applicants that may hinder open discussion, you really want to try to avoid that. Step 4 is to create your cohort materials and platforms to house those materials. Again, the KM training package includes templates for all the session slides and the breakout activities that we looked at, but you'll want to set aside some time to adapt the materials to your context. Step 5 is to actually host the 4 cohort sessions. We also like to do dry runs before each session and a debriefing after each session to kind of talk about what went well and what we could improve. Step 6, if your goal is to reach a wider audience outside the cohort, you can synthesize, document, and share out any key learnings from the cohort, for instance, through a blog post or a photo journal. But if you're using photos, just make sure to get consent from participants before publishing. And then lastly, it's always important to get feedback from participants so you can make improvements for your next cohort. So as I mentioned, the module includes guidance and considerations for adapting the program to an in-person setting. So here are some of those considerations. The first and most obvious consideration is the additional cost required to host an in-person cohort. This may include things like airfare, accommodation, event space, snacks and meals, evening entertainment. The timing of an in-person series may also be different. So rather than breaking up the virtual sessions over several weeks, an in-person series can really be facilitated in just 2 or 3 consecutive days. And since the in-person sessions are half or even full days, you obviously want to make sure you're allowing time for coffee and lunch breaks. And then lastly, you'll want to provide participants with printed worksheets or a workbook instead of a digital format that we use in the virtual setting, so that they can work through the KM techniques and activities. And again, the module does include an adaptable template of a worksheet for an in-person session. So that is our overview of the Learning Circles module. We're really excited to have this published and see other teams take the reins, run with the module, and start implementing their own Learning Circles cohorts. I'll pass it back to Rowena.
Thank you so much, Sophie. I know there has been a lot of excitement around learning circles and interest in the program and wanting to know how we do it, if others can do it. So we really hope that with the tools that we've provided on the KM training package in this module, that others could really take the information and kind of run with it, because knowledge success doesn't need to be the only ones hosting learning circles. We'd love to get people's feedback too. If you use the module, what you found useful, if you find anything that you think is missing, to help you implement a Learning Circles cohort on your own, please do reach back out to us and let us know. So we are at our Q&A portion. So we're happy to take questions from folks. Please put your questions in the chat. And we have received some questions already. So we can start by taking and responding to those. So the first question here is from Kate. Do you have suggestions for delivering these trainings virtually across multiple time zones? Also, what suggestions do you have for using these modules for coaching or one-on-one professional development? So maybe I can ask Sophie to come in here, since I know Sophie's been involved in lots of different trainings where people do come from multiple time zones.
Yeah, so I can take that first piece and then maybe hand it to either Sarah or Rowena, since you have more experience on the one-on-one piece. But in terms of time zones, so knowledge success, we take a regional approach. So if you're able to really consider hosting regional trainings so that participants are based in the same time zone. But if that's not possible, you just will want to try to find a time that really accommodates as many participants as possible that fit within the standard 9 to 5 work hours. And then I also wanted to add that in terms of scheduling a trainer, in addition to thinking about time zones differences, you also want to consider things like national and religious holidays and avoid scheduling on those days so that people can participate.
Great. Yes, thank you. Thanks, Sophie. And in terms of the one-on-one, I think that's a great question. And I think you could do it in different ways. One thing I will say off the bat is we really encourage people to take the slides and make it their own. So definitely I would encourage whoever is planning on being the coach or the trainer to take a look at the slides initially and adapt them to your own purposes, make them more relevant to your specific context. We've tried to make them as general as possible so that they could be applicable to a wide variety of scenarios. But I think it'll be more meaningful if you can adapt them to your own particular scenarios. So that's definitely one thing I would start with. And then, you know, one way to approach a one-on-one training or a coaching type of scenario is once you've adapted that training deck, you could maybe then share that with your mentee and have the mentee potentially like look through the slides on their own and then meet together to kind of go over any questions that they have or have a discussion about what they got out of that slide deck. Another approach is that you could walk through that information together in a session and have that discussion as you go through the information and share that information with them. So those are just a couple of ideas of how you might go about that. The next question here is this is again about learning circles. So have there been any evaluations that show the impact of learning circles? So I'll hand that over to Sophie as well.
Thanks, Rowena. So yeah, in addition to seeking feedback from our participants at the end of each series, we also did kind of a more in-depth evaluation of an earlier iteration of the Learning Circles model. And we did this evaluation in 2022. And this included an online survey of our Learning Circles participants and in-depth interviews with selected participants. And the evaluation showed positive feedback for many aspects of the model. For example, interviewees described Learning Circles as a forum that was open, respectful, conducive to easily sharing information. People also agreed that Learning Circles was a useful model for learning what works and what doesn't work in family planning and reproductive health. And they said that they would recommend the model to other colleagues. The evaluation also revealed several positive outcomes. For example, most people said they applied information that they gained from Learning Circles to inform program design, improvements, and policy. More than half of the interviewees noted significance of new relationships with peers working in FPRH in other countries that was fostered through learning circles. Most interviewees reported learning new ways of sharing knowledge with others and how to better manage knowledge overall. And some also reported that they integrated KM or applied the KM techniques used in learning circles in their own work. So those were just some of the positive results. And we did publish the results in an article on the KM for Dev journal, which we can share a link to in the chat.
Great, thanks, Sophie. The next question we have here, I think it came right around the time you were presenting, Morgan, around the behavioral sciences. And this question was like, they would like to have some recommendations for ebooks that you consider to be practical. So I don't know, Morgan, if you know off the top of your head any, ebook or other type of digital resource that you might recommend, or maybe we can follow up with a short list of recommended readings after the webinar.
Sure. I mean, if this is just in relation to behavioral science more broadly, there are tons and tons of really good ebooks. Thinking Fast and Slow, Nudge, Scarcity. I can put all of these in the chat. In terms of ebooks for like specifically knowledge management, behavioral science and knowledge management, I don't know of any off the top of my head, but maybe I can, as a group, we can think a little bit about what those might be. But if it's just behavioral science, there's tons, and I have really good recommendations.
Great. That would be great, Morgan. I think, having a short list of like, this is where you should start, I think that would be really helpful. Sarah, we have a question here around your experience in hosting Learning from Failures events and what types of failures people share, and do you get an experience where people are sharing failures that really aren't failures?
Yeah, thanks for this question. To answer the first part, there are all types of failures that people share, and we really do encourage people to think about their role in a specific failure. And so sometimes that influences what failure people feel comfortable sharing. As I mentioned in the presentation, we don't want this to be an instance of blame or people, sitting around pointing fingers, but really to think of what happened, analyzing the situation, what could have been done differently, and what role that person had. So for that reason, there are all types of failures. There are, at small levels, big levels. Sometimes it's important. Sometimes it's nice to start small with something that feels a little bit more safe to share, because it is really being vulnerable, sharing, what your role was and it's something that didn't go as you planned. So there are things related to systems and supplies for family planning. There have been technology fails related to, apps and mobile versions of things. There have been in-person failures that have been shared. And can you remind me what the second part of the question is, Rueda?
I think it was around like if people tend to share failures, think that they're sharing a failure, but it doesn't seem very much like a failure that they're sharing.
Exactly. Yeah, that's a really important point. Sometimes, so we call that a humble brag. You might have heard that term where, someone is actually sharing a success, but it's sort of framed as a failure. We try to discourage people from doing that, and, kind of a success disguised as a failure, but really sharing things that really did not go as you planned and kind of digging into that. So we do a lot of coaching. If we're working with kind of panels of folks sharing failures, we do quite a bit of coaching, and we're always happy to look at people's stories in advance. Also in the module, it has some some more examples of failures and kind of ways to work with different storytellers.
Great, thank you. And it looks like we're at time, and I think we've gone through most of the questions. So with that, I would like to thank again everyone for joining today, and just wanted to encourage folks, if you are not signed up for our newsletter called the KM Explainer, This is a periodic newsletter where we share tips and tricks on how to use knowledge exchange tools that are presented in the knowledge management training package. So we definitely encourage you to sign up for this periodic newsletter, and we'll drop the link in the chat. I think Sophie has already done that, so thank you, Sophie. And we will be sharing the recording of the webinar in both English and French via email to everyone who has registered, along with the slide deck. So I know a lot of questions in the chat were around that. So thank you again. Have a good rest of your day wherever you're calling from, and we'll see you another time. Take care. Bye-bye.